continue to rise. However, we still have significant demands on our healthcare system. So we're not in a position to open everything at once, certainly, but we are in a position to slowly ease, very minimally, some of our restrictions. We know that these last few weeks have been especially tough. These last many months have been tough, but these last couple of weeks where we haven't been able to gather with anyone outside of our household have been especially tough on Manitobans. We're now able to loosen some of the restrictions regarding outdoor gatherings. We know we still need to continue to follow the fundamentals. We still need to ensure we're getting vaccinated as soon as possible, and that includes getting our second dose. We need to do whatever we can to ease that pressure on the acute care system. So our new public health orders will take effect Saturday, June 12 at 12:01 a.m. and will include those provisions for outdoor gatherings with up to 5 people in public and on private property. For private residences outside, you can have up to 5 visitors, but they should be from no more than 2 households. And of course, this is in addition to those who already reside at that household. For public spaces, you can meet up with a total of 5 individuals, so outdoor group sizes in public are at 5. These are the only changes that will be occurring at this time. All the other restrictions will remain in place. So indoor public gatherings are not permitted and visitors are not permitted on private property except in those certain outlined circumstances. Retail businesses may operate at 10% capacity or 100 customers, whichever is lower. Only 1 person per household is allowed to enter a business. And many businesses and organizations will remain closed. For personal services includes gyms and fitness clubs, restaurants, bars, including patios, personal service businesses, museums, galleries, libraries. The heat-related amendments made last week for libraries and community centers will remain in place, but are only to be used as needed. This applies to swimming pools, wading pools, and splash pads. Employers are now are also required to have employees work from home where possible. And malls will have increased requirements to manage the capacity and assess to ensure stronger compliance. So they will have the same requirements as per our orders that are in place right now. Kindergarten and grade 12 schools currently learning remotely in the cities of Winnipeg, Brandon, Red River Valley, Garden Valley school divisions will continue until the end of the school year with some small group meetings allowed. Schools in Moore and Dauphin will continue remote until June 21. Although the public health orders will allow for some small outdoor gatherings, people are reminded to minimize the amount of contacts you have outside of your household, to stick with those fundamentals, to ensure distancing, wearing masks, and at appropriate times. While the risk of transmitting the virus is certainly diminished in the outdoor setting, it's not zero. So we need to ensure we're practicing those fundamentals, staying home when we're ill, still trying to reduce the amount of contacts we have outside of our household. The revised travel orders are being drafted and will be ready tomorrow. Once signed, they will go into effect 12:01 a.m. on Friday, June 11th. And those will have individuals who are fully vaccinated, 2 doses plus 2 weeks, will not require isolation upon entry into Manitoba, provided that they are symptom-free. They'll need to monitor for their symptoms, but they will not be required to isolate upon return. At this point, fully vaccinated people, if you're identified as a close contact, and you are fully immunized, you may be exempt from requiring the isolation or quarantine, provided you have no symptoms, do not live in a healthcare or long-term care or congregate setting, and do not have a medical condition that could compromise vaccine effectiveness. So certainly those individuals would be required to monitor for symptoms for those 14 days and isolate immediately should symptoms develop. And again, when the travel order is changed, those who are asymptomatic and fully immunized more than 2 weeks out of that second dose will be exempt from the requirement to isolate upon entry to Manitoba. Those arriving internationally will have to follow the federal quarantine guidelines. So these public health orders are starting to outline our path forward. While we really just allow just a slight opening right now, again in those outdoor settings, those lower risk settings, we're still encouraging people to follow the fundamentals to reduce contacts. Do make an appointment to get vaccinated as soon as possible. And continues to be up to us to make a difference, to bring down these numbers, to bring down the strain on the acute care system, and this through this collective action, through our collective practice of the fundamentals, we'll see these numbers continue to decline, we'll see our vaccine rates continue to climb, and we'll see that opening plan shortly. So again, thanks to all Manitobans, and I'm going to pass this over to Lanette.
Thank you very much. Good afternoon, everyone. The recent lower case counts provide some reassurance as well as some light at the end of the tunnel for our system. Manitoba's healthcare facilities continue to face extreme pressure throughout this third wave, with a high number of new patients arriving to our hospitals daily for inpatient care and sometimes intensive care services. Our focus remains on meeting the needs of our COVID patients, with many services having to have been reduced or scaled back as a result. Our goal is to get through the worst of this third wave and support the many very ill patients who require our services, and then slowly resume the other services that are currently decreased or on hold. As of midnight, there were 151 patients in our intensive care units receiving both COVID and non-COVID care. This includes 121 in our local provincial facilities, as well as 30 patients who are in hospital outside our province. 27 are in Ontario, 2 are in Alberta, and 1 is in Saskatchewan. A reminder that the normal pre-COVID baseline capacity for Manitoba's intensive care units is 72 patients. There are currently 97 COVID patients in ICU, including 67 locally in Manitoba. 4 patients were returned to hospital in Manitoba yesterday from Ontario to continue their care, and no COVID patients have been transferred out of province since June 4th. We are also saddened to report that 2 COVID patients from Manitoba who were transported to separate Ontario facilities on May 25th have died. The individuals were a man in his 70s and a woman in her 60s. And our condolences go out to the loved ones for their loss. Each wave, we have adapted our planning and preparations to meet the needs of Manitobans. But each wave has been distinctly different in terms of the number of cases, the speed of the spread, the demographics of the Manitobans who have most been impacted, the severity of the illness, and the impact on our staff, which becomes exponentially compounded as the pandemic drags on. Each wave has taught us how to adapt our responses and to learn how to manage this virus. In wave 2, we were able to staff and maintain 121 critical care beds and focus significant efforts on supporting and stabilizing the staffing situations in our personal care homes. In wave 3, with the gift of the vaccines, we have seen younger and generally healthier patients who come to us still very sick, but our preparation has focused on establishing as much hospital capacity as possible and enhancing the training to improve support for staff who are providing care in the acute care environment. 15 more nurses have begun their 2-week orientation in the ICU last week. And they are joining 119 nurses who have already completed this enhanced 2-week orientation. Since April last year, we have had 130 nurses go through the full critical care nursing orientation program. We have had 12 respiratory therapy graduates begin orientation at HSC and St. Boniface Hospital just very recently. And we will continue to recruit and orientate staff as the demand requires so that we can meet the needs of Manitobans. In addition to our local efforts, we have also received staffing assistance from the Public Health Agency of Canada, the Canadian Red Cross, and the Canadian Armed Forces. To date, 14 nurses have been deployed to emergency medicine and surgery units. 2 medical assistant teams have been dispatched to the alternate isolation accommodation sites. An aeromedical crew with the Hercules aircraft to assist with patient transports, and 3 medical lab technologists have been deployed to support COVID-19 testing at the shared health labs. Another major initiative that has had a significant impact in helping us tackle this 3rd wave has been to increase hospital capacity through the virtual COVID program, which is virtual VCOP, we call it, to support home monitoring of patients. As of Monday, we have 43 patients who are enrolled in this program, 31 who are on home oxygen. And this program, since launching in December, has saved 1,337 hospital inpatient days. We also, since April 20th, have made a concerted effort to transfer patients who are suitable and capable of living in personal care homes. So 418 paneled patients have moved since April 20th, and that equates to about 40 to 50 transfers a week, which is unprecedented in our healthcare system, and a credit to all the teams who are working collaboratively throughout the province to get this done. So kudos to all of you, and as well as the family and loved ones who are supporting us in these efforts. We will continue to work on these initiatives and ensure patients have reliable access to appropriate care and keep this capacity available within our hospitals. Throughout Wave 3, efforts have remained on increasing capacity in our intensive care units. The extremely high case count numbers have increased the demands on these services, obviously, and these pressures have triggered arrangements with other provinces who have capacity to care for some of our medically stable but critically ill patients. We are very grateful to our neighbors for their ongoing support in caring for Manitobans, and we are grateful to the families as well for their understanding. Our goal remains to create as much capacity locally to care for all those who need our care in ICU. However, we anticipate that the support of other provinces will remain an important resource for us in the coming weeks. Out-of-province transfers also remain an option for us as we evaluate the risks of delayed surgeries. And these delayed surgeries are not unique to Manitobans, but it is something that we absolutely must stay focused on. And to date, we have had 2 elective cardiac patients sent to one to Quebec and one to Ontario to have their surgeries last week. So we thank our colleagues in Ontario, Alberta, and Saskatchewan for their assistance in caring for Manitobans throughout this COVID pandemic. And finally, all these efforts I've outlined have freed up substantial capacity within the hospital while continuing to provide Manitobans with the care that they need. However, while case counts are improving and more people are getting vaccinated every day, we are not quite out of the woods yet, and our hospitals are still feeling stretched. The variants are still spreading, and patients continue to be admitted to ICU in very high numbers. We had 8 new COVID admissions to ICU over the past 24 hours, and this follows this past weekend where we had 24 patients admitted to ICU in a 48-hour period. And we know that outside of ICU, thousands of non-COVID patients, invisible patients really, remain waiting for care. Approximately 15,000 non-urgent and elective surgeries have been postponed in Winnipeg alone in the past 15 months. And I know that everyone is very tired of the public health restrictions, but we just need to hang on for a little bit longer so that the transmission rate can continue to fall and the pressure on our hospitals can begin to ease. We need to do this for our healthcare workers who have shown unwavering dedication to their profession and to their patients over the past 15 months. So please follow the public health orders, help lower the transmission rate, and if you haven't made an appointment to get vaccinated, please do so as soon as possible. And let's just keep doing what we can to protect each other, and hopefully we will be able to enjoy our summer together. Thank you very much, and we can open the line to questions.
Thank you. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from the Winnipeg Sun, Scott.
Hi, good afternoon to both of you. Dr. Roussin, just to clarify on the outdoor gathering, is it 5 people from a max of 2 households plus the household members that are actually hosting those people?
That's right. Yeah, on a private property, we just to clarify there, it's in addition to the household. So you can have up to 5 over, including in addition to your household. Those 5 though should not be from any more than 2 households.
All right, thank you for that. The second question, it says in the orders here that patios are not allowed to open. Those are outdoors. Restaurants are struggling right now. Why are patios not allowed to be opened when they're outdoors? And I would imagine would follow the same science and the low risk of somebody hosting a barbecue in their backyard.
Yeah, the issue here is that this really isn't signaling an opening. We still have, demands on ICU. We still have Manitobans receiving care outside of Manitoba right now. What this is more of that release valve. We realize that Manitobans have been following the orders. They haven't been able to really get together with anyone outside of their household. So we've allowed just this sort of release valve in the interim. Those type of things are coming in the near future. The vaccine rates are coming up, our numbers are coming down, so there is hope in the window, and there'll be more to come on that. But right now, we're just not in a position to really signal an opening. This is more just to allow people to have some more of that contact.
From CBC Manitoba, Bart.
Hi there. Ms. Siragusa, forgive me, this is a slightly boring technical question, but the 2 deaths that you just mentioned, the patient transfers, are they included in the Manitoba totals for the daily deaths or the overall deaths? And are they in addition to previously disclosed statistics?
I believe those are hot off the presses, Bart, so they will be included, but they are not yet.
Thank you very much for that. You talked a little bit about building capacity in the ICUs, and we've seen, you know, without trying to politicize it too much, or at all rather, lots of discussions about what existed before and the changes that were made. This is, unfortunately, may not be our last pandemic. Where should our standing ICU capacity be, staff-wise, beds, per capita or total beds after this now?
Yeah, that's a great question, and our clinical leaders are looking at that now. I think previously we were in the ballpark of other jurisdictions throughout the province. And there were slight changes to the models, like we maybe in Manitoba had more step-down units than our neighboring provinces. But definitely, you're right, the goal going forward is that we have the ability to surge up in our capacity, and that means making sure that we have trained individuals ready to go and deployed throughout the system, so that we don't have to go on this roller coaster of public health orders and restrictions, that the system is ready and able. So those conversations are ongoing, but certainly we have learned a lot from the last 3 waves, and we will use that going forward to make sure that we're prepared long term.
So they had a really horrible second wave spike and managed by the hair of their teeth to keep their ICUs, they had a lot. They're 2/3 of our population, and they have more than 220 ICU spaces staffed. Japan has a hugely greater number than most developed countries, in terms of staffed ICU beds, according to research that you folks have cited. So, given what you've just said here, you wanted to avoid that roller coaster. Should we be looking, in theory, of 50% more, 100% more, 200% more, at least in the staffing capacity now, knowing what we've been through?
The answer is yes, we should be looking at all those options. But the one thing that we also don't want to do is we don't want to have nurses standing around with nothing to do. So we want to train nurses. We also have a lot of surgeries that we have to catch up on. So we have to look at the total demand of the health system and have a conversation about how are we going to, it may be that we cross-train nurses. Like I don't have all the specific answers, Bart, but I'm saying there's lots of options that we can look forward to. I think that we probably need more nurses in the system, and we need to be very intentional as to where we recruit, how we retain, and the training mechanisms that we provide for them, how we educate them and support them to do what we need them to do. And so we want them to, it's a complex undertaking, but there's definitely lots of conversations and calculations going on right now in order to build that capacity for the future. And we're talking months. There's going to be short, there's going to be medium and long-term initiatives.
From the Canadian Press, Steve.
Oh, hi, Dr. Roussin. We've heard for a long time now that a lot of the cases are coming from social interactions and social gatherings. And I know obviously you can't forbid them forever, and we've been in a tough spot here where most people just cannot see their friends. You're putting some faith, though, in people, correct, to follow the rules and not move the gathering indoors and not have it a larger than permissible gathering that's prolonged. Do you think that Manitobans will follow the rules?
So we've had that faith all along in all of our waves. We've relied on Manitobans So, you know, most of these orders are quite broad and difficult to enforce. So we've relied on Manitobans, and Manitobans have stepped up for us. And so, yes, I think we're once again relying on Manitobans to know that we're not signaling an opening here. We're just signaling that Manitobans have given up so much. Haven't been able to see the people they care about in so long, even outdoors. So a bit of that release valve here right now for Manitobans. But yes, we still are going to rely heavily on Manitobans to follow the fundamentals, to follow the spirit of what this represents for these next few weeks, because we're seeing more and more vaccine. We're seeing the start of these numbers coming down, and so I really think the next many weeks are starting to look a lot better than what we've been through for these last number.
And you mentioned possible future changes when asked about patios and the like. How long are these new orders in effect for, and when do you foresee the next round of changes?
Yeah, so these are going to be in order for 2 weeks. While we further assess, we're going to have some more information this week on some reopening plans. And so we'll have more details on that.
From CTV Winnipeg, Stephanie.
Hi there. We saw in the COVID update today that a teen in Winnipeg had died, which is one of the youngest deaths in the province up until this point. Is there any more you can add to this? Any other details that can be shared?
You know, I don't have any details to share at this point, you know, other than this is just you know, yet another tragedy in Manitoba. This pandemic has cost us so much, and you know, my condolences go out to their loved ones, but I don't have any details at this point.
And are the Manitobans who have been infected with the Delta variant, are they getting more sick compared to the other variant cases?
You know, as of right now, no. We haven't seen an increase in hospitalizations or severe outcomes in the relatively small group at this point, but we'll of course be following that closely.
From City News, Mike.
Hey, good afternoon. This question is probably best suited for Dr. Gray, although he's not speaking, so I'll ask it anyways if you can answer it. Thanks for that. The transfer of patients out of province, I know that you said it's not a perfect science, and they try and take the middle ground patient. Quite a few of those patients, since this began, have passed away out of province. Is this just how unpredictable the stability of a middle ground patient is? Is it the travel, or is it just that it is not a perfect science?
Didn't hear it.
Oh, yeah, I think they were the question again. I guess Lanette didn't hear. Maybe we'll have that repeated. It was more about the severe outcomes in relation to transfers outside of the province.
Can you repeat the question? Sorry.
Yeah, I can. Sorry. So the transfer of patients out of province for ICU care, we've heard before that it's the transfer of middle ground patients and that it's not a perfect science, but quite a few of those patients have passed away out of province. Is it just how unpredictable the stability is of a middle ground patient? Is it the travel, or is it just that this is not a perfect science when sending someone out of province for care?
Yeah, it's actually probably a little bit of both. So the disease nature of COVID is you can be stable. These patients were moved May 25th today, the ones that we reported on today. So things do change with the disease. When they're deciding who is moved and transferred, they do look for people, of course, are critically ill if they're in the ICU, but they are stable at that point in time. So they have stable oxygenation status, they have a stable blood pressure, and they are a particular weight that is okay to transfer by plane to another facility. So it is a judgment call based on what the critical care physicians are seeing, and It's not a perfect science because people's status change for sure. So it's all of those factors go into the outcome of someone who has COVID.
Thank you for that. My second question's been answered already, so I'm good to go. Thank you.
From CHVN, Taylor.
Hi, good afternoon. We know that Father's Day is coming up. It's going to be included in these orders. Are you anticipating an increase in cases?
You know, we always have to be cautious around these special dates, and we've seen in the past on a number of them, we have seen that spike. So, you know, we do have fairly strict orders, even, you know, despite these very minimal loosenings. So I think we definitely need to pay attention to those fundamentals. The outdoor visits, again, if you're feeling ill, stay home. These outdoor visits are intended still to limit the amount of contacts you have. And so all these precautions that we take, you know, gets us into our reopening plan sooner. If we see a spike in cases, it slows our reopen plans. So we still need everyone to be on board right now. Practice those fundamentals. Let's continue to bring these case numbers down, and then we'll see soon the plan that will let us implement if we continue our progress here.
Thanks. And with the outdoor gatherings, should they be designated people? Could you potentially have a group of 5 in the morning, then a separate group of 5 in the afternoon?
You're right. So, you know, so the orders don't require a designated group of people. But again, our strong messaging is limit the amount of contacts you have outside your household. So we do want people now, you know, people who have been following these orders haven't seen really anyone outside their household, and so people are going to want to take advantage of this to see some of those people, to gather outdoors in lower risk settings. But again, the caution is this is not to vastly increase the amount of contacts you have outside of your household. Be cautious, practice the fundamentals, and you'll see really shortly that we have some plans for our future to get back to a lot of things we love, but they all rely on bringing down our case numbers and bringing up our vaccine numbers.
From the Winnipeg Free Press, Katie.
Good afternoon. Lanette, Siragusa, I'm wondering about patients being transferred within Manitoba. How many patients are currently being transferred to other hospitals, and where are they being sent, and how are they being chosen for transport?
Well, the ICU patients are limited to 4 facilities, so that's Brandon, Grace, St. Boniface, and Health Sciences Center. If they require less than critical care but still need inpatient services on a medicine unit, then that is a conversation that happens. As much as possible, we want to be able to deliver care closer to home, but not all facilities have the skill set to manage these patients. So it's really variable depending on the needs of the patients and the capabilities of the site. So it can change, just like the admissions into hospital every day, the transfers can change as well.
Okay. I'm also wondering about the impact of long-term COVID patients on future hospital capacity planning, because you spoke earlier about the expansions to the virtual program for at-home monitoring. But what about the long-term patients who still need hospital care? Are we having to devote extra space for them?
Yeah, that's a really good question, and that's an evolving part of this process that we continue to learn about is this long COVID and the effects. So certainly when people are in ICU or in medicine for long periods of time, their bodies do weaken, their lungs, it's a disease of the lungs, and that weakens. So every individual manages it different, but what we are seeing is that there is an increased requirement of rehabilitation services. So that might be respiratory therapists, physiotherapists, people do not, and I can't generalize it, but there is a portion of the population who it takes longer to recover, and weeks for sure, if not months, until they get back to their current state. So it's definitely something that we do have to look at, and you're right, that virtual connectivity with those rehab sciences experts is something that we definitely should be looking at.
From Global News, Anya.
Good afternoon. This might be for Dr. Roussin, but we'll see. Can you explain the transmissibility of the Delta variant over other variants, and if the increase in cases within days is concerning to you?
So with the variants of concern, we find that they're all significantly more transmissible than the wild type virus that we dealt with in the first and second waves. So B117 alpha variant is our dominant strain, and we find that to be 50 to 70% more transmissible than wild type. Delta we find and evidence currently showing that it is probably more transmissible than even the alpha variant. And possibly significantly more. And so, we don't have the ability right now to screen for Delta. We do find it through genome sequencing. Most of these we found were related to travel or to household transmission, although we have seen some clusters. And so we've seen in other jurisdictions that Delta variant can become the dominant strain. So we are aggressively managing all of our case and contacts as if they are VOCs, and we've been doing so for quite some time. So we're going to continue to do what we can to minimize the impact of this. The real importance to Manitobans with this Delta variant is that we need that full vaccine status. So a lot of Manitobans have got that first dose. We need the Manitobans to continue to do so if you haven't, but we need to ensure we close the loop and get our second shot, because what we found is that first dose may not be as effective against this Delta variant, but 2 doses still brings great protection.
Okay, thank you for that. And both of you might have different answers for this one, but is the federal assistance stabilizing our situation or allowing us to see some sort of relief in Manitoba yet?
I can start, and Dr. Roussin might have more to add, but they are helping. We are in contact with them regularly. They are constantly screening to see what kind of workers are appropriate to come to Manitoba. So we're working with national partners as well as local at the site, who they need and where we can deploy them. So it's not massive numbers, but it's enough to take some of the edge off, and it's an ongoing conversation that we meet not every day, but several times a week to find the support. So it's very much appreciated, and I would say every little bit helps.
From the Brandon Sun, Kimberly.
Good afternoon. This question is for Dr. Roussin. Dr. Roussin, if people don't follow the public health orders, how long before we see that reflected in our numbers in ICU and new cases and so on? And then what do we do?
So if, any kind of changes that we make as far as, case numbers go and public health interventions and sort of changes in our behaviors, we're going to see that lag of about that 10 to 14 days. So, around a couple weeks following a change in orders is when we start to see. Sometimes we might not get the full effect from that until 2 incubation periods. And then if we start talking about ICU numbers, then that's a lagging indicator. that lags another 10 to 14 days following an increase in cases. So there is that lag time in both case counts and then a further lag with hospital and ICU admissions.
Thank you. And then what is the protocol going to be if we see our numbers go up?
So, our first, priority is to protect the health of Manitobans, and that requires us to protect the healthcare system. So if we saw increasing numbers that we couldn't control through other public health measures, aggressive case and contact, identification and isolation, or now vaccines, then we'll always have to ensure that we're protecting Manitobans. So public health orders and restrictions are always on the table. Our goal is that as we slowly start to reopen, as we quickly increase vaccines among Manitobans, we're not going to have to rely as readily on the public health restrictions and focus a lot on public health advice.
Our final reporter this afternoon from CJOB, Skylar.
Hi, Nurse Siragusa and Dr. Roussin. Thanks for your time. Dr. Roussin, in response to one of my colleagues' questions earlier, it became quite clear that not allowing restaurants to reopen their patios is not about the science of the spread of the virus, but rather more of a psychology aspect. Can you explain what might happen in your view if, say, you were allowing restaurants to reopen their patios this weekend, and what Manitobans might kind of think from that, and where it could go from there?
Well, certainly our public health messaging, the risk communication has always been important. And when we saw, Manitobans feeling the risk of transmission is great, we see good adherence to our orders. And so the risk of reopening too soon not only puts us at risk because of the direct transmission we see from those actions, but we also see it related to just the risk perception. And so when many things are open, when many things appear to be back to normal, it affects everyone's actions that maybe more and more things are back to normal. So right now we still didn't want to signal that this is really a reopening. This is really that release valve, a much needed one. But we'll see later this week. We have a plan moving forward that's going to really paint out the picture for Manitobans if we continue to keep our numbers down.
Okay, thank you for that, and I'll leave you with the softball, I guess, before a bunch of angry golfers start talking to your fine communications folks. I'm assuming the outdoor gathering limits reverses the household-only requirement for recreational places like golf courses or, say, tennis courts.
That's correct. So group sizes of 5 outdoors with no requirement that those are from your own household.
Thanks, everyone. This concludes our media briefing.
Thanks.